All right, guys. So labor is first. Let's do the definition of labor. Basically, how we diagnose labor. So the definition of diagnosis of labor goes like it is defined when there are irregular, painful uterine contractions. So can you see here? So we have regular. Sorry. So we have regular, painful uterine contractions, and we have what we call as progressive cervical change. Okay. So progressive cervical change, basically what it means is it means effacement and dilatation all at the same time, right? Basically both of them happening together. So contractions alone do not diagnose labor. We must have the cervix changing along with it for it to be the diagnosis. Okay, so diagnosis of labor is based on regular painful uterine contractions and progressive cervical change, which basically includes effacement and dilatation. Now, what does not diagnose labor? These may occur before, during, or after labor, right? But they're not part of the diagnosis of labor. So bloodstained mucus plug does, which is basically the show, it does not diagnose labor. Also, the spontaneous rupture of membranes, it does not diagnose labor. So bloodstained mucus plug, which is your show, and spontaneous rupture of membranes, basically both do happen in labor, but they do not diagnose labor. For diagnosis to be made, you need regular painful uterine contractions and you need progressive cervical change, which includes effacement and dilatation. Both. Contractions alone do not diagnose labor. Cervix must be changes. Now you have stages of labor, right? So in the first stage of labor, you go from diagnosis of labor to full cervical dilatation, which is 10 centimeters. So in the first stage of labor, you have to go from the diagnosis of labor to the full cervical dilatation. And diagnosis of labor was basically regular painful uterine contractions and progressive cervical change, which included effacement and dilatation. So from that point onwards to the 10 centimeter full cervical dilatation is basically your first stage of labor. Now, first stage of labor has two further differentiations. It has the latent phase and it has the active phase. What does the latent phase basically do? The latent phase has regular painful contractions and the cervix effaces or dilates basically from the 0 to 5 centimeter. So the cervix dilatation goes from 0 to 5 centimeter in the latent phase, and this is when you have regular painful contractions, and the cervical effacement is also occurring. So usually in the primary gravida, this is longer, but in the multipara, this is shorter. So just to make it a little clearer, in the primary gravida, this is usually up to 20 hours, and in the multipara, this is usually up to 14 hours. Now we move on to the active phase of dilation. When does the active phase of labor basically start? So all of this is the first stage, right? So we're still talking about the first stage of labor. The first stage of labor has a latent phase where the pregnant woman or the woman at term now has regular painful contractions and her cervix is dilating from 0 to 5 centimeter and cervical effacement is also occurring, right? That's your latent phase. And the active phase is when your dilation is happening from 5 to 10 centimeter. This is faster cervical dilatation, right? And the progress should continue steadily without any obstruction. If cervical progress is poor, roughly less than 2 centimeter in 4 hours, you assess for delay and you consider intervention according to guidelines, okay? So when should you be worried in active phase of labor? You should be worried when the cervical progress is low or poor. Basically, less than, what are we seeing? Less than 2 centimeter in 4 hours. Less than 2 centimeter in 4 hours, this is the point where you assess for delay and you consider intervention. Okay, so active phase is 5 to 10 centimeter dilation, and this is when you have faster cervical dilatation. Progress should continue steadily. When do we say cervical progress is poor? We say it's poor when the cervix starts dilating less than 2 centimeter in 4 hours. That's a problem. Now we move on to the second stage of labor. Now the second stage of labor starts when the cervix is already dilated to full 10 centimeter. From this point to the delivery of baby is your second stage of labor. This also has two phases, right? There's a passive phase and there's an active phase, right? Now, the passive phase is when there is full dilatation of the cervix, but there is no urge to push the baby yet. This is when the baby descends and rotates. Okay, so in the passive phase of the second stage of labor, there is full dilatation. There is no urge to push the baby yet, and the baby descends and rotates. In the active phase of labor, basically, there's a strong urge to push the baby. There's a baby visible crowning is seen. The mother reactively pushes, right? So this active phase, there's a strong urge to push, the baby is visible, crowning can be seen, and mother is actively pushing. A normal duration. So in a nulliparous woman, a patient who was pregnant for the first time, usually less than or equal to 2 hours of active pushing, may be longer with epidural is normal. Okay, less than or equal to 2 hours of active pushing by a nulliparous woman is normal. But in a multiparous woman, this is usually less than or equal to 1 hour. Okay, now we have a third stage of labor. From the delivery of baby to the delivery of placenta and membranes, this should be usually delivered within 30 minutes. 30 minutes is equal to prolonged third stage unless physiological management is chosen. Okay, so this should happen under 30 minutes. If it's happening over 30 minutes, you are dealing with a prolonged third stage of labor. Yeah? Okay. What else? Now the duration of labor. Let's look at the duration of labor a little bit. Like this is very important for examination. Now, a primary gravida, her average is going to be 8 hours, 8 hours of labor, but prolonged will be more than 12 hours. And a multivara, the average is 5 hours and prolonged will be more than 8 hours. What is precipitate labor? Precipitate labor is delivery within less than 3 hours of regular contractions. This is called precipitate labor. In order to learn this mechanism of labor, we have a mnemonic called every darn fellow is extremely rude every day. Okay, every darn fellow is extremely rude every day. Let's look at this picture to understand the mechanism of labor. Now, the mechanism of labor starts with engagement. Engagement is when the biparietal diameter passes the pelvic inlet. Okay, so the biparietal diameter has passed the pelvic inlet at this stage. This is clinically said. So, clinically, this engagement happens when 2 out of fifth head is palpable abdominally. So, whenever 2/5 head or more than 2/5 head is palpable abdominally and the biparietal diameter has crossed pelvic inlet, we say that the baby has engaged. You can remember it by this funny little mnemonic where the baby is giving an engagement ring, right? Okay. Then we have the descent. Descent is basically the baby moving down through the pelvis. And then we have the flexion. Flexion is basically the chin flexing to the chest, right? Can you see that the baby's chin is flexing to the chest here? So flexion is basically the chin flexing to the chest. Can you see the smallest head diameter presents in flexion? Okay, smallest head diameter is presenting in the flexion. Then we have internal rotation. Internal rotation is said when the occiput rotates anteriorly. Okay, so the occiput rotates anteriorly to an occipital-anterior position, and this is internal rotation. We then have extension. Extension is when the head crowns. Basically, crowning occurs and head extends under the pubic symphysis. So imagine this is the pubic symphysis and the head is extending under the pubic symphysis. Then we have restitution. Restitution is also known as external rotation. This is when the head rotates to align with the shoulders. Okay, so the head rotates to align with the shoulders, and then we have delivery, or we call this expulsion or expulsion of infant, right? The anterior shoulder comes first and the posterior shoulder comes later. Always remember the anterior shoulder comes first, the posterior shoulder comes later, and then comes the body. So that's your mechanism of labor. You can remember it with every darn fellow is extremely rude every day. You can pause here and revise the mechanism of labor also.